I have friends who work for organizations who are in charge of positions, and the top guy has an MBA, not an MD. And they are making the decision that's affecting what the MDs do. The MDs can't provide the care that you would like. There's a financial reason why that doctor can't talk to you as long as he wants, because there's an incentive behind doctors moving and seeing as many patients as possible. In a perfect world, I would love to spend time with my patients, but we kind of get graded on how fast we go, how many patients we've seen, how many we move through. A common term you hear in certain physicians is move to meet. How you like to be referred to as a patient as meat? Move to meet? What meat do we move in patients, especially in the emergency medicine field? So it's difficult. If you want a doctor who listens to you, there's still a bunch of them around. I know some very good doctors. I know one good doctor, this guy here. I refer my wife to one of those doctors in the Lehigh Valley. I'll say his name, Dr. Om Sharma. He's a doctor at Eastern Hospital, excellent doctor. I refer my wife to him. I'm not saying no other doctors like that. There's one doctor that I know who will listen to you regardless. They're doctors who really are old school, who don't care about money, who don't care about family. This doctor will visit you at 3 o'clock in the morning in the hospital. So I refer my wife to him as her primary care doctor. There's certain doctors who practice concierge medicine, whereas, for one low price, you pay for them for the year and you're theirs. So pretty much they're on call 24/7, and they'll listen to you for as long as you need them, because a lot of, when I train doctors under me, I tell them you can learn a lot about a patient by just listening to them. And also they'll say something like, well, that's the diagnosis, because they just said something that you didn't realize when you just sit there and listen to patients. You learn a lot by listening to patients. Also look at certain hospitals. Some hospitals are better staffed than other hospitals. Believe me, I've tried in my own way, trying to get things to change at certain places that I have, or some places that I've been or will be or have been. I'm trying to incriminate myself here. It's hard to change a culture if you're one person. That's number one. I'm just one person. So if I'm the only ER doc complaining, keep in mind, emergency medicine, as an ER doc, I just come to the table just with my skills. I treat patients for one point in time. So if someone doesn't like me, I could get fired and they can replace somebody right after me. So I don't really have that much power. So we need power in numbers, multiple ER docs, plus some of the primary care docs need to get involved, because what I'm noticing, what some people have noticed at certain hospitals is that, for instance, the ER docs may not have power, but the internal medicine docs and the specialists have power. You know why? Because if you make me unhappy, if I decide to leave, it doesn't hurt the hospital. They get a new grad from Lehigh Valley or from St. Luke's to replace me. If you make an internal medicine doctor unhappy or a cardiologist unhappy, guess what? They take all their patients, they go from Lehigh Valley to St. Luke's, and St. Luke is making their money. So guess what? You better make that cardiologist happy or internal medicine person happy. But how do you get them to change their mind? Because some of them are either okay with the system or stagnant, don't care.
We can all understand your frustration, because we have been frustrated professionally, in my case, for about 48 years. And I think a major answer to your question is education. I've had patients tell me, hey doc, when I was in school, they taught us about vitamins and minerals and good things to eat and bad things to eat. My kids don't get that now. Actually, we don't get that in medical school. So education is the bottom line, so that then everybody can make your own choice. You can choose to eat donuts for breakfast, or granola for breakfast, or some protein for breakfast. But if you don't have the education, the understanding, the data on why to make those choices, then you're lost, except for the television. So it's education, education, education. That's a whole other discussion, and don't get me started on that.
I know, that's what I'm saying.
Why not?
What were we just talking about? I want to hit on something that, what's your name?
Jim.
Jim, I want to hit on something that Jim talked about, and also Dr. Will. This idea with capitalism and also with patient care. And Dr. Will was talking about seeing as much patients as you can, as you're getting graded for that. And one of the things that I've noticed with the patient care that I'm in is the amount of paperwork that comes along with being in healthcare and treating patients. Is more, I spend more time on paperwork than I do with a patient. It's sad, I mean, I'm not a fast typer. I mean, I've gotten better in the years, but my paperwork initially, when I meet with a patient, I try to meet with them for about an hour to an hour and a half, and that's a critical time for me because I got to know everything about them, from the biopsychosocial history, their family history, everything. And then I got to do paperwork. And then, the next 2 days afterwards, the insurance company wants to know if they're on medications yet, or did they see a psychiatrist yet, or, all these things that we're being rushed because of money. They want to get them in and out. They don't want to pay for the full length of stay, which is a 30-day or 28-day program. So they want to get them out. Let's get them on their meds, and after 7 days, they can go back home to their family. Well, their family's pissed off at them. Excuse my French. We need to get the family up here too. Patient care is very critical, and there's sometimes when management above me, or there's a certain protocol that we need, that we may need to get people in treatment, and they may not be appropriate for our level of care, but we need to get them in because we need to get the money. But are we able to provide them the services that they need? And that's something professionally that I've had to struggle with. And how do I manage that anxiety that I have and the frustration? But it's about patient care. And I'm not going to put all the blame on the system. But, I will put some blame on the system. But there's a lot of other factors on why people relapse, or why people, some people don't need to go to treatment and they can stay clean and sober, and some people may need it. So I'm not just going to blame the treatment industry or the healthcare industry, but there's a lot of many variables, why people relapse and get back into the criminal justice system. One of the things is, back in 2006, I did research, and I don't know, in the state of California, there's prison systems all over California. And what California was trying to do is trying to have treatment modalities for long-term treatment programs for about a year. Get the prisoners who are in treatment and put them into a long-term treatment program. Because 33% of the prisoners were in there because of some type of substance-related crime, whether an alcohol-related crime, or possession of cocaine, or being arrested while under the influence. And so they wanted to get these people out of the prison system and build treatment programs in California. And who do you think did not want that to happen? Who do you think was against that? Prisons. Yes. Prisons, because yeah. So there's a lot of people in the criminal justice system today that have a substance use disorder, and with the substance use disorder, it's the only disorder that I know that when you're acting on, when you have a symptom, when the symptoms of the disorder surface, like relapse, you can get, there's consequences for that. But any other illness, and I don't want to get into a debate, but any other illness like diabetes, if they forget to take the insulin, it's not a crime. But if someone relapses on alcohol and they hit their wife, or they do something stupid because of being intoxicated, they go to jail. So